My name is Manuel, and I consent to the video.
My name is Maddie Somino, and this will be my psychiatric assessment. Okay, so prior to entering the room, what we did was obtain the patient's vital signs, height, weight, and BMI. After the patient has entered the room, we want to provide privacy, whether it be closing the door or simply shutting the curtain. During this assessment, we will be monitoring for any abnormal muscle movements. We will be monitoring how the patient communicates with us and document that towards the end of the assessment. We will begin now. Hello, my name's Maddie, and I will be your nurse today. How are you?
Good.
Can you tell me your name and age?
My name is Walter, and I'm 29.
Okay, Walter. And what brings you in today?
I hear a voice named Hannibal telling me to do bad things.
Okay. Can you describe those bad things?
It's just telling me to hurt other people.
Does anyone else hear this voice?
No.
Have you ever been hospitalized because of that voice?
Yes.
Can you tell me a little bit about that?
I was in a state hospital at first, and then I went to a private detox facility 2 times after that.
Okay. Looking at your chart, it says here you are currently on Abilify. Is that right?
Yes.
Do you have any allergies that you know of?
No.
Alright. And how are you feeling in general today?
Okay.
Well, Walter, what we are going to do is do a head-to-toe assessment on you, if that's okay. It will consist of me checking your eyes, listening to your lungs, feeling your throat, checking for any swelling, and listening to your abdomen, and checking your legs. And then we'll move on to the next assessment, okay? Are you okay with that? All right. So first thing I'm going to do is check your eyes. Just look up for me, and I'm going to check your conjunctiva. It is pink and moist. Okay. Now we're going to check your eyes. Look at my finger, please. You're going to see a light. Okay. Eyes are equal and reactive to light, measuring about 3 millimeters. Okay. Now what we're going to do is check your mouth. If you can say "ah" for me. Okay, the uvula rises. There are no teeth missing. And oral mucosa is pink and moist. Okay. Now I'm going to feel your throat, okay? We're feeling for any swollen lymph nodes. We're assessing for the carotid pulse as well. I'm going to check your thyroid. Okay. Raise your shoulders for me. All right. Now we're going to listen to your lungs, okay? Take a deep breath. Deep breath. Deep breath. Deep breath. Okay. Lean forward for me. Deep breath. Deep breath. Deep breath. Okay. Lung sounds are clear bilaterally in all 4 lobes. We are now going to check your heart sounds, okay? Okay. S1 and S2 are present. Looking at the patient's skin, there is appropriate hair distribution, brown in color. Touching the skin with the back of my hand, it is warm to touch. We're going to look at the patient's fingers. There is no clubbing noted. Capillary refill is less than 3 seconds. Can you squeeze my fingers? Tight, tight, tight. All right. Can you push me away from you? Now pull me towards you. Good deal. Okay. All right. Now what we're going to do is assess your abdomen, okay? And we know that we have to do this in a certain order. We will inspect first, then we will auscultate, percuss, and palpate. We do not want to disturb any bowel sounds by palpating before all that. Okay. Are you having any pain in your abdomen?
No.
Okay. No abnormalities noted just by inspecting. We are going to auscultate right quick. Going in a clockwise order. Okay, bowel sounds are present and active in all quadrants. We will now percuss. And we will hear some resonance. Now I'm going to palpate, okay? Let me know if you have any pain. Okay. We are now going to move down to your legs, okay? The skin in the lower extremities appears to be pink and dry. There is also appropriate hair distribution in the lower extremities, brown in color. There is no swelling noted. We're going to check his pedal pulses. They are strong bilaterally. Okay. And that is it. All right, Walter. The next assessment is called an Ames scale. What we're going to do is monitor or assess for any abnormal involuntary movements that can be caused by medications like the one you're on right now, Abilify, okay?
Mm-hmm.
So I'm just going to ask you some questions. Do you ever notice any muscles on your face moving without you moving them purposely?
No.
Okay. Your lips, have you ever noticed any puckering, pouting, or smacking without you doing them intentionally? Okay. Now, what about your jaw? Do you ever feel your jaw clenching without you doing it purposely?
No.
Okay. Does your tongue have any abnormal movements? For example, darting in and out of your mouth and just not being able to control it?
No.
What about your upper extremities, like your arms, wrist, hands, or fingers? Do you ever notice any jerking or repetitive movements like a rolling motion?
Just my hands shaking.
Okay. And your lower extremities, your legs, knees, ankles, toes, are they ever just kind of squirming around?
No.
Okay. Your neck, shoulders, or hips, you ever feel like they're rocking or twisting without you being able to control them? Okay. Do you wear dentures, or are those your own teeth?
My own teeth.
Okay. All right, Walter. Moving on, we're gonna do this Columbia Suicide Severity Rate Scale, okay? So it has a few questions, and all you have to do is say yes or no. Okay? And you are doing great. Have you ever actually attempted suicide?
No.
Okay. Have you ever purposely self-injured without any intent of suicide?
No.
Do you ever wish to be dead?
No.
Do you have suicidal thoughts?
No.
Have you experienced a recent loss or a negative event in your life?
No.
Are you currently pending incarceration or homelessness?
No.
Are you currently pending isolation or feeling alone?
Yes.
You have a previous psychiatric diagnosis and treatments, which is your Abilify. Are you feeling hopeless or dissatisfied with that treatment? Are you non-compliant with the treatment?
No, I take one pill.
Okay. Are you feeling hopelessness?
No.
Are you feeling helplessness? Do you feel trapped? In your chart, it said that you had gone to some detox facilities. Would you say you have substance abuse or dependence?
Yes.
Are you feeling agitated or anxiety? Do you feel as if you were a burden to your family or others? Do you have chronic physical pain or another acute medical problem like COPD, cancer affecting your life? Have you ever had homicidal ideations?
No.
Have you ever been sexually abused?
No.
Is there a history of suicide in your family?
No.
I know these are a lot of questions, Walter. We're almost done. What would you say your reason for living is?
My family.
Okay. Do you feel as if you have a responsibility to your family?
Yes.
Would you say you have a supportive social network or family support?
Yes.
Do you have fear of death or dying due to pain or suffering?
No.
What do you think about suicide? Do you think it is immoral?
Yes.
Do you have a high spirituality?
No.
Are you engaged in work or school? And have you ever contacted a suicide hotline?
No.
Have you wished you were dead or wished you could go to sleep and not wake up?
No.
Have you actually had any thoughts of killing yourself?
No.
Has there been a time when you started to do something to end your life, but someone or something stopped you before you actually did anything? Has there been a time when you started to do something to try to end your life, but you stopped yourself before actually doing anything?
No.
Have you taken any steps toward making a suicide attempt or preparing to kill yourself, such as collecting pills, giving away your valuables, getting a gun, or writing a suicide note?
I've given away some of my things.
Is that it? Okay, Walter, that is it. I appreciate your time. What I'm gonna do now is give this completed assessment to the physician, and he will be in with you shortly, okay? All right, thank you.